Hello, guys. Welcome to the first episode of this podcast. We're gonna have so many episodes like this, and it's gonna be great, right? We're mostly gonna cover dental health, oral health, or whatever you want to call it, and make sure that you guys have the greatest and healthiest smiles of all time. So, obviously, we can't do that without having an expert, right? Without having the greatest doctor, whom I call the greatest, right? Dr. Buleni. And she's gonna teach us all about oral health, and we're gonna dive into different types of topics, and you know, we hope you enjoyed. So, today's topic is how stress destroys your teeth. Most people don't talk about this. I won't lie, I also wasn't attentive to it, but Dr. Buleni, I'm sure, knows how bad it gets and knows how serious it can be if you don't address it. So, Dr. Buleni, I'm gonna ask you the first question, and that is, in your experience, how often do patients come in with stress-related dental problems without even knowing stress is the cause?
I think once a week, I would have a patient presenting with the symptoms of stress, even though they are not aware that it's related to stress. So yeah.
Hmm. And can you say what's the first thing you would notice in that patient's mouth that you'd be like, oh, okay, this person is under a large amount of stress and pressure.
The teeth definitely take a toll because I've realized that people who are stressed, they'll tend to clench the muscles. Hence, when you are under stress or you're angry, people are like, okay, take a deep breath, uh, unclench your jaw, relax your shoulder muscles, relax, breathe.
Mm,
So when people stress, they really clench hard, like, and then they'll have obviously the muscle pains, pains on the cheeks, and more headaches because the muscles are being pulled out a little bit more, and also because they're grinding a lot, then you'll find that then their teeth are one off because of the stress, because they're like, and just grinding their
yeah.
teeth. And you'll find that they also do that at night when they're sleeping, unaware that they're doing it. Yeah.
Yeah. Doesn't that long-term cause any jaw problems?
Absolutely. Like I said, because the jaw is completely compressed all the time, you don't even give it any problems. You have TMJ issues, you have migraine issues, you've got headache issues, you've got ear issues, you've got jaw problems, you've got some neck pain. So definitely it will affect.
Mm. And under the topic of stress and dental health, I've heard a term called bruxism. You'll tell me if I'm pronouncing it correctly, but can you please tell us what that is and why stress triggers it? How does it relate to stress?
Bruxism is the clenching of the jaw and then grinding your teeth in a normal way. Because when you eat, you move your jaw up and down. But when you are stressed, you clench and then you move sideways. And as you're clenching and also then grinding your teeth, that we call that bruxism. You brush off the enamel, the
Mm,
teeth get cracked. The cheeks get some ridges on the side, the tongue starts to scallop. People, they'll see their tongue as if it has
mm,
like the indentations because it is pressing so much on the teeth, and it causes some dents there. You can see the shape of the teeth on the tongue based on the pressure, because they're clenching so much and they're not allowing the tongue to move properly. So that is basically bruxism, where you are just clenching off your teeth. And obviously, it's some people, it shows as some gums are ready and puffy, because the teeth are being clenched so much. Besides the jaw pains and and the muscle pain on the gums as well, they take their toll because when you are pushing your teeth against each
Mm.
other in more than a normal force, the gums will take a toll because the periodontal ligament, that is, I normally say the periodontal ligament is more like the shock absorbers of the teeth. As we all know that when you eat and when you chew, the teeth, the periodontal ligament will take absorb the pressure of that, such that you don't feel. That's why you don't feel pain when you're chewing, because it's enamel to enamel. However,
Mm.
if you now are clenching and bruxing, then your gums will tend to be more robust and more swollen, red and puffy, and there can be bleeding as well. And there is also some the reason as well for bleeding gums, you know. And then obviously with time, then the teeth becomes more sharper because they're being bruxed off or being worn off by you just bruxing.
Mm. So is that something that can permanently cause damage, or can it be reversed? Is it reversible?
Um, the habit can be reversed, but the damage on the teeth, you can't reverse it. You can repair it because you've already worn off your enamel. So the only
Mm.
way you can do is just to make sure that you reverse it, not reverse it, you prevent it and treat it. For an example, your gums are normal, your teeth are normal, and then you start eating them off. The best thing, reverse that by relaxing your muscles and stop grinding, and if you have stress related issues, then you see a therapist or you take ashwagandha, whatever makes you to relax, or maybe some sleeping pills or meditate, anything that will help you to relax your
Yeah.
muscles so that you can reverse. And then with your teeth, then we can do therapy on your teeth, whether we do composite bonding or ceramic crowns or veneers, depending on how bad the situation is. But most of the time, we'll always do the composite one because with the ceramic one, most of the time people tend to break the teeth because now they continue with the habit while they they continue grounding while they have new teeth, and you'll find that the teeth get broken off. And we can also
Mm.
make what's this, a night guide for you to help with the clenching of your teeth, so that even if you continue to clench your teeth, your jaw, and brush off your teeth, if you have
Mhm.
a night guide, it's more like it's rubbery. Then it won't, you won't brush your teeth off, yeah. While you're
Mm.
probably taking your medication to relax your muscles as well, but you also do the therapy as well. Like I said, it's therapy, but you cannot reverse the damage on the teeth.
Mm. And does stress in any way affect the way your saliva um like produces itself, and does it also maybe affect your wisdom teeth in any way, or is that a myth?
Absolutely. We know that we need saliva so that you can have a cleansing of the bacteria and food in the mouth. So if you have less saliva, that means there's less cleansing of the teeth. If you're eating high acidic food or high starch food, then it changes to acid, and then it also affects your teeth, and then they have caries. So now you have less buffering in your mouth. You have more caries. The tongue starts to take a toll because it needs that moisture. Because also it helps to, like I said, it neutralizes the acid in the mouth. Then
Mm.
you'll have what you call, the enamel is dried off. When you're chewing, when you're bruxing, then you crack your enamel even more, you know. Um, and obviously it's going to affect your mouth breath. You'll have halitosis because it helps to cleanse out the mouth and remove all that bad bacteria as well. And people like that tend to have sticky mouth or dry mouth, and makes it difficult to swallow, have bad breath, or a metallic taste. Some people be like, but I have a metallic taste. But that's because you don't have
Mm.
the saliva content that is appropriate for your mouth. So definitely stress will affect your saliva flow. And another practical way I can explain it is that because you are stressed, you're clenching, and then you press on your
Mhm.
saliva You have salivary glands here and also under your tongue. So when
Yeah.
you're cleansing, you're pressing on those salivary glands. They can't freely release saliva. Your tongue, because it's just locked in between your teeth, like these are your teeth, this is your tongue. Your tongue gets those indentation here, and the salivary glands underneath the tongue are just being suppressed. Therefore, the saliva is not flowing freely. The saliva is not flowing freely, so it affects the salivary flow as well. So yeah, there's so much that stress shows in your mouth, besides the teeth, besides the saliva, content as well. I'm sure a lot of people are not aware of the saliva content as well, but it does really affect a lot in the mouth.
Yeah, that sounds like a chain, basically a chain reaction. Because of stress, there's no more saliva, which probably means there's it's bad breath and there's cavities and all other things that come along with it. Almost sounds like dental health is probably one of the most important things because that's where the chain reaction usually starts. I mean, we've heard about if maybe you got heart problems or stroke problems, you should also check your dental health because that can give doctors an idea. So I want to know how specific does it come to when we look at stress. So can you examine someone and be like, okay, based on this person's teeth, they're probably having financial stress or relationship stress, or is it not that deep yet?
No, no, no. I'll just say stress, whether it's work, emotional, financial, jolo related. No, I wouldn't say this is because of this particular stress, but it will be stress because stress just the
Mm,
body when it's under stress, it cannot tell you this is stress because of this.
mm,
You would then discern as a human being that, oh, I seem stressed lately. What has been stressing me? If you're really cognizant of your body, and then you can take just a record of your body, like, oh, actually, this week I've been stressed a lot because of one, two, three. Let me fix that so that it doesn't affect my overall body. You know, but I
mm.
can see
Yeah.
that you are stressed because also the signs of the stress also are similar to the immune suppression as well.
Mm. That's interesting. So can you give us ways to prevent um teeth grinding? What would you if someone would come in and tell you, they're grinding their teeth a lot, obviously seeing a therapist and all of that or fixing your problems obviously would be the main solution, but as a dentist, like what can you do on your side to make sure that the patient doesn't ruin their teeth?
Um, when people are stressed, we can say that they're kind of depressed as well.
Mm-hmm.
And then if somebody is depressed, they normally neglect self-care. And
Mm.
if you can't wash your body, do you think that person has time to floss and brush their teeth? And
Yeah.
and obviously, if you are depressed or you have stress, even your choices on food are more comfort, more donuts, more, snacks,
Mm.
not the healthy diet. Your mental health is not in a good position to be able to make such great decision. At that time, it's also affected. And for those who are on caffeine, they eat more, they drink more coffee. The people who rely on alcohol, they drink more alcohol, and both of them they affect your saliva flow as well. Those who smoke
Mm.
and vape, they do that as part of what's this coping. So
Mm.
what I would do is that what I normally suggest then is that as much as you are under stress, whatever stress is, whether work, emotional, financial, jolo, whatever, you know, try to take
Yeah.
care of yourself, one day at a time. Brush your teeth, make sure you floss. Eat more healthy food as well in the process. Um, and if you
Mm.
need, and reach out for help as well. If you feel like you can't cook, reach out for help. Ask your friends to cook for you, so that you can have a healthy meal, and talk about it.
Mm.
Talk to your therapist and talk to us as dentists. I think we are underpaid therapists in a way, because
True, I agree.
because always listen to stories and be able to, you know, give advice, or be an ear to listen. Because sometimes you just need somebody to listen to you. Not that you need a solution, but or an answer, but the more you talk about it, the more heavier it feels on you.
Mm. So
Yeah.
would you say, obviously there's some people who are constantly under pressure, either at work or, usually at work, and it's just their life, right? Obviously, we get used to pressure. I mean, as a doctor, you'd know best that pressure is always like, your best friend, right? But then like, would you say a night guard, is a permanent fix to that in terms of stopping the teeth grinding, or is it more like a band-aid and soon you'll have to, you know, face whatever you're going through and stop the whole stress as a whole?
Um, I think it's a combination of both. It's a band-aid and more like a fixed term kind of thing, because, like I said, you have to be able to relax your muscles. And now, when you're sleeping, it's your subconscious mind that is still controlling you, because now you're not conscious because you're resting. And if you're under
Mm.
stress, then the subconscious mind is it taking it as it's taking over your body. You will clench your teeth. When you have a mouth guard, then it can absorb that. But I realized that some people who are really stressed, they can grind off that night guard within 2 days. You know,
Really?
yes.
Wow.
Yeah. So that's why I'm saying, even if we do ceramic restorations on those people, they're gonna grind off their teeth. They break them off because the ceramic you can't grind it off. They end up breaking the teeth themselves. So we always go for composite, the resin restorations to restore their teeth that they've worn them off. So I really suggest that if you know that you are constantly under stress, whether it's at work or other things, try to find the root cause and try to fix that. Because once you fix that, then your body then relaxes and be able to adjust as well. So always find the root cause and then fix that.
Mm. Yeah, and I agree with you because actually I think there was a time when I had retainers and I was like under a lot of stress. And by the time I looked at those retainers after a few months, they were rough, right? And I just realized that I was grinding my teeth. So I could actually agree to that. So the last thing, and I'm gonna close it with this question. So if someone is listening to you right now and is listening to this and is going through a stressful season right now, what's the one thing you want them to do for their dental health this week?
Pray.
That's not a bad solution, actually.
Okay, yeah. So basically, pray or meditate. Uh, Continue to brush your teeth, continue to floss, continue to use your fluoridated toothpaste and mouthwash. You know, if you feel
Mm,
like you want to really cleanse or you find yourself cleansing, then take a sugar-free chewing gum and try to just chew on it, and try to relax.
mm,
And every time you can see that you're being stressed out, remember to take a deep breath and then release your shoulders, unclench your jaw, and continue to breathe until you can feel that your muscles are relaxed. And that can be something
mm,
that you can practice daily, every time you feel stressed out. But more than anything, find the root cause of your stress and find a solution for it. Because sometimes we tend to ignore the root cause, or we feel like it's too bigger than me. There's nothing you can do about it. But believe you me, there
mm.
is always something you can do about your stress. or something that is bothering you. So always find a way to deal with it and make sure you eliminate it from your life.
Yeah. Well, no, that's a great way to end it. And I hope everyone who's watching this now knows what stress does to your teeth, and not only your mental health or other body parts, but trust me, most of the things we go through as humans, it also affects our dental health. And I think these, podcast episodes like actually show you how important your dental health is and how much it affects your whole body. And we hope to bring light into that. And we hope you also enjoyed this episode. Thank you, Dr. Buleni. See you again on the next episode, episode 2. I'm already excited for that.
Thank you so much. I just hope so people learn something, even if it's one thing, I'll be grateful. Yeah. Thank you guys. See you on the next one.
Yeah.
Thank you. Bye.
Peace.